Brothers and sisters, in my long practice, I observed patient will ask how to distinguish migraine from common headache. So this is how to do it. It is very easy. Migraine runs in families, and it is long. People suffer with migraine, maybe early ones or on a daily basis, and it will run in families also. The migraine headache usually one side, but not necessary. It will be both sides, particularly in children also. I am Dr. Panneer, neurologist working at Apollo Heart Center. I have been working at the main hospital since this beginning of the starting of this hospital. So way back, Chairman PCR gave the approval for starting a migraine clinic, which was approved by Vice President Dr. Preeta Reddy and very well approved by Dr. Satyabama DMS. So this is the first thing. Easy to distinguish in the sense the migraine persons will have a long history. It has been since childhood, since school days, since college days, or even it may continue in their middle life. That is number one. The other thing, between the attack, the patient will be normal, and the migraine headache is throbbing, pulsating, and the attacks will vary in the same individual as well as attack to attack in different persons. So this will be variable. There is no uniformity. That is also one important thing to remember. So migraine headache, distinguishing between migraine headache and common headache is very easy. So because it should have the following features which I have mentioned: pulsation, throbbing, and they don't like sound, noise, and smell sensitivity and movement sensitivity. These are the and ultimately it may end in either nausea or vomiting. This is the common picture of migraine. Migraine is a very age-old disease, more than 3,000 years old. The Egyptian papyrus also mentioned it got its name migraine. It is a Latin word. Latin migraine means half of the head pain. That is how it got. But it is not necessary. In children, it will be both sides, it will be affected, or it may start on one side and then spread to the other side also. The characteristic feature of migraine is it is throbbing or pulsating pain, but it may not be uniform. In the same patient, from attack to attack, it will be different, and it will be different in different persons also. That is also must be there. You must bear in mind. Then other thing, if the attack is very severe, at that time patient will have noise sensitivity, sound sensitivity, and smell sensitivity, and movement sensitivity will be there. And in the end, some people may have nausea or vomiting. In children also, or in infancy also, it can present how during that time they will have colicky abdominal pain, or in young age they may suffer from travel sickness like car sickness. So these are things or instead of pain in the head, in children it may be in the stomach they will feel pain, or it may be pain in the neck, or it may be pain in the face, or pain in the chest. These are some of the things it may be these are some of the things it will be there. But please believe that there is no biological marker for migraine, and no test can detect the migraine. It is only a dialogue between the patient and the doctor that will clinch the diagnosis. Doctor will ask some questions, and if you answer the questions relevantly, there ends the matter. And in between the attacks of migraine, the patient will be very normal. Only during this. Another most important thing which everybody doesn't appreciate, migraine occurs in 4 phases. First phase, the premonition or prodrome. It is a non-painful area. In that they may suffer few hours or 1 or 2 days before, but yawning or craving for food like chocolate, or irritability, or elation, or extreme tiredness. This will be there. These things are equally, interferes with the patient's thing. And the importance of recognizing this, if we can give medicine at this stage, the person will not go and develop the migraine. So that is the most important thing. Next phase comes is an aura phase. I will brief it later. Then third phase is headache phase. Headache phase is, it will be unilateral, not necessary. It may start in the neck and spread to the temple sides of the chest, throbbing, pulsating, and asthma, the aversion to light, aversion to smell, aversion to noise. This will be, and movement sensitivity will be there. It may end up in vomiting, and after sleep, the patient will usually recover from the attack of. Sometimes migraine can occur in this way also. The person wants to enjoy holidays, and if he goes on tour, he may develop headache in the holiday spot. Reason, he might have traveled by the night by car and missed his sleep, or he may sleep more, or he may not follow the earlier things, early to bed, early to rise, and he may take different kind of route. So it is called holiday migraine. Also weekend migraine. Patient will think, for 2 days I don't have to go to office, so let me sleep late, let me watch a video, let me eat something, and let me wake up late. Then he will wake up with headache only if he changes his usual routine. That is another important thing to remember. So there is migraine can be easily diagnosed, can easily be treated. That is very important. Migraine is on the rise or increasing because now lifestyles have changes, like particularly by IT people it is more common, and people who work in the shifts also it is more common. That is also very important. And the lifestyle changes also increases the incidence of migraine. Then regarding treatment, main thing I will be focusing, prevention is better than cure. So if you follow the guidelines of the doctor, if you identify what are the triggers, like if you are not going to sleep earlier, you have to change the sleep hygiene, you have to eat routinely, and you have to do some exercise, and not to indulge in too much get addicted to cell phone, and that blue light from the laptop and other things also will be important. So simple living will be the easy answer. And regarding the treatment, normal painkillers also, which is available without the prescription, also will control the medicine. But the secret is you must take that painkiller at the beginning of the headache, with maximum dose of the painkiller at the beginning of the headache, and take some rest. Even it is a nap, short nap also will help. So these industries should provide some place where the person who is suffering from migraine, he should, when there is an headache, he should take rest, she should tablet. Within few hours he will recover, and he may be able to produce the thing. Because loss of man hours, woman hours, because of that, it is loss of money in billions, which runs in billions for the exchequer. Then because of frequent migraine, the school days are affected, the working days are affected, our personal life is affected, relationship is affected. We have to remember that, and we must change, listen to the advice of the doctor. Then second, regarding the prevention, you identify what are the things which provokes migraine. That is what is called triggers. It may be a stress, or it may be not a proper sleep, or indulging in food diet. There are certain kinds of foods like monosodium glutamate, MSG, which is used in Chinese food, that can trigger things. And red wine and smoking and kitchen smell and then strong perfumes can also trigger the migraine. So these are some of the things which one should identify, try to remove that. That is the simplest way. Then another thing, if some migraine people, they take for months together strong painkillers, then they suffer what is called medication overuse headache, because then that is a very tough problem. Patient needs to be detoxicated, patient may have to admitted to remove all those unnecessary medicines. It will take some time also. That is very important. So the other important thing, sometimes when the migraine reaches more than 15 times in a month, it is called chronic migraine. Then the doctor will prescribe medicines to prevent the frequent occurrence of migraine. That is one way of treating the migraine. The role of diet in migraine is commonly, I don't think there is anything special. So except some of the things which may, that is red wine or cheese. Chocolate is not usually mentioned as a trigger, but it may not be trigger. As I told you in the beginning, in the prodrome phase, they will be craving for thing. It is chocolate is not starting. During the prodrome, they may be craving to indulge in some carbohydrate things. So that is the there, and red wine, cheese, and pickles, fermented food. So it may be something very variable, and this also occurs only during the vulnerable period and more than one trigger to act together. Another important thing, certain special populations, what happens during the migraine in women, it may be related to the hormones, sex hormones. That is one important thing, and how you have to manage in a special way during the pregnancy and during the postpartum, and another thing in children. So these are some of the important issues we have to consider. Unfortunately, people think or made to think that migraine they have to suffer for lifelong, which is not the truth. So people thought he or she has been suffering from migraine for number of years. Then they come to the conclusion, till my last breath I have to suffer. Not at all. It is a myth. So only thing, you follow the simple rules like early to bed and sleep hygiene, and regarding follow the diet, regular meals. Don't skip your meals. That is another important thing. Try to do exercise, and even meditation, simple meditations will do. I am very particular. Outdoor exercise is more important, not in a gym and other things. That is not our culture. So please do outdoor exercise, aerobic exercise outside, that will be there, or swimming, dance also will be very, very good, important thing. So if you avoid the triggers, then migraine may not be there. If you have to change the workplace also, it will be there will be too much noise in the workplace, in the industry, or there may be too much noise in the IT thing. So this person can be alerted relatively a safe place where it will not be so much noise, and there must be a provision in the industry to provide a resting place for such people to recover quickly from migraine after taking rest, short nap and tablet. This is also very important. In abroad, it is recognized as a disability, but in our country it is not recognized as a disability, and the insurance company does not allow claim on migraine. That is absolutely incorrect. We have to respect. There is a migraineurs. They have got the right to speak, and it is also a biological disease. You have to accept their claim. So it is very important to you have no justification in rejecting the claim for the patient regarding migraine. So this is a biological disease. So he suffer, particularly when he is vomited, when he is admitted for drip with severe pain, and if IV fluids are given and if IV medications are given, then you have to respect that. Then another important thing, sometimes when the migraine is important and it rises very quickly, and this patient starts vomiting in the beginning, then the route of administration of medicine will be different. It has to be administered either through the nose or through the injection or through the drip. This is also a very important thing to remember. You must have a positive attitude to treat anything. You must have faith in the treatment. You must have a faith in the doctor. Faith cures. Faith moves mountains. So these are some of the things I would like to mention to my brothers and sisters. I hope, be happy, live peacefully and live blissfully. This is my simple advice. So laughter is the best medicine. That too, belly laughter is the best medicine. So it cures. There is nothing. no need to be, and say simple to say Om, keep on repeating Om and within yourself, and it creates tranquility of the mind, peace of the body, and you get really well. You can withstand any stress. That is one of the simple things which our country has taught. And meditation is important, and yoga also you can include. To give some instances regarding migraine, as I told you, very common in women. One person in Indian or the PAO who lives in England, she came. She is about 40 years old. She told when she came to Chennai, she saw me. She told for nearly 20 years she has been suffering from migraine. Then after listening to her, and several times scan was done, nothing was, everything was normal. Then I gave some treatment, simple. There also I used to give magnesium. It is considered in migraine heads that magnesium content will be low. This is very important. Then harmless magnesium supplements also improves or cures the migraine. Then number 2, riboflavin, one factor of the B complex, that also helps to get cure from the migraine. So this is very important because these two things, magnesium and riboflavin, are harmless substances. They are called nutraceuticals because the mitochondria, the powerhouse of the cell, that will be using these things. So if you give these things without strong medicines, they can give. And migraine treatment also in these patients, it is stratified care. I have to give a prescription in this way. I have to explain to the patient. Patient education and family education also very important. Let them understand. I have to tell that it is due to change in the brain chemicals that you are suffering from migraine. You do the following alterations in your lifestyle, that also will improve the migraine. Then something, we have to give 2 kinds of prescription in the sense that for strong attack of migraine, I will give one type of medicine. For mild attack of migraine, I will prescribe medicine. The patient knows from the attack itself this is going to be mild shows she need not take migraine specific drug. She can take some simple painkiller and the migraine will go, particularly following with a rest and relaxation. If it is strong migraine, then migraine specific drugs, sometimes called triptans, they are used to treat migraine when the patient understands this attack is going to be. But always the point to be emphasized, the patient has to take the medicine at the onset of the migraine, at the beginning of the migraine. That is the most important thing. Hope I have answered reasonably all the questions. Dr. Panneer, who has been practicing at the Apollo Heart Center, Chennai, and practicing earlier, all along I was practicing at the Apollo Main Hospital, Greaves Road, for the past 35 years. Once again, thanking you. Jai Hind.